Should I have my camera on?
Mm-hmm.
Oh my God, I got an egghead.
We're live. We're live, so
I'll mute myself.
Just going to wait a couple of minutes for just any late joiners. So good morning, everybody. We'll just go through some housekeeping before we get on with the presentation. So good morning, my name is Gemma Callow. I'm one of the 2 communications managers for the Clean Air Zone. I lead on stakeholder engagement. I'm joined by my colleague Peter Edwards, who's the Principal Clean Air Zone Officer. He leads primarily on the exemption side of things. So this morning, what we're going to do is we're going to talk through the Clean Air Zone, how it will operate, what support's available, and then at the end we'll go through any questions. So as the meeting's going along, if you do have any questions, if you pop them in the chat, and then we will answer them all at the end. Just to remind everybody, we are all working from home at the moment, so there may be dogs and children, etc. in the background, for which we will apologise in advance, but hopefully we will get through this as smoothly as possible. We'd also like to just extend our thanks. We know you're all incredibly busy at the moment, so thank you for taking the time, and we will do our best to get through this as quickly as possible so you can get back to your day job. So I'm just going to make the presentation live now. I'll talk you through this. So let's just start here. Okay. So I obviously don't need to tell you, you work in the industry, you'll know this better than I do, but air pollution is having a serious impact on people's health. Across the UK, it's been declared a national emergency, and in Birmingham alone, it's contributing to up to 900 deaths every year through conditions such as heart disease, lung disease, asthma, cancer, etc. We've got some of the statistics on screen here relating to Birmingham. I won't go through them all, you can all see them, and like I say, you're probably more familiar with this than anybody working in the medical industry. So as a result, we have been instructed by the government to introduce a clean air zone to bring air pollution levels down to a safe and legal limit and improve air quality for everybody. So on screen here are some statistics. These were taken pre-COVID relating to travel behaviour in Birmingham city centre. So what we can see here is that 50% of all journeys undertaken in Birmingham city centre are via car. And of those, 250,000 journeys every day are less than 1 mile. So these are journeys that could be walked and cycled, etc. And these are the journeys that we're hoping we can encourage a travel behaviour change with. So the clean air zone. So as mentioned, the government has instructed that air quality needs to be improved, and clean air zones are going to be introduced all across the country. We're starting with Bath in March, and Birmingham will go live on the 1st of June this year, having previously been delayed from summer last year due to COVID and from January last year due to issues with the government vehicle checker. So it's been delayed by 18 months, but it is ready to go live this year. We're introducing a category D clean air zone, so other cities will introduce other operating models. Our model means that we will be charging all non-compliant vehicles, which includes private cars. Non-compliant vehicles we will talk through in a second, but it's important to reiterate that the clean air zone is not the same as a congestion charge. A clean air zone will only charge the most high polluting vehicles, and we expect that to be about 1 in 4 vehicles that's charged. So 75% of vehicles will already be compliant and will not need to take any action. The zone, as you can see on screen here, it's the blue area. It's everywhere within the A4540 Middleway, but not the Middleway itself. So you can drive around the Middleway, that's fine, but as soon as you enter the blue zone, you will be subject to charges if you're in a non-compliant vehicle. The charges are £8 a day for cars and taxis and vans, and £50 a day for coaches, HGVs and buses. It's important to note that a day is midnight to midnight, not 24 hours from when you enter the zone. So if you drive in at 10 PM, leave at 2 AM, you've crossed that midnight threshold and therefore will be subject to 2 charges. During that midnight to midnight time frame, you can enter and leave as many times as you want for a single charge. There is a 13-day payment window, so you can pay 6 days prior to your visit, the day of your visit, or 6 days after. And you can do that online or over the phone using the government payment system. If you don't pay, you will be charged £120 a day for in a fixed penalty notice. And that will be per day that you miss. So if you don't go in on a Monday and a Tuesday, you would get 2 fixed penalty. You don't pay on a Monday and a Tuesday, you would get 2 fixed penalty notices. They are reduced to £60 if paid within 14 days. There will be signs. We've got about 300 signs going up all around the border of the clean air zone to warn people they are approaching, but that's the only warning you will get. You will not receive a text or a letter, etc. So the onus is very much on the driver to know that they've entered the zone and to arrange payment. Okay, next slide, Pete. I think you've got control now. Okay, so with regards to the clean air zone, it's important to stress that this is not supposed to be a money-making project for the council. This is purely intended to clean up air pollution levels in the city. If we make no money from this project, then we've succeeded, because it means there are no high polluting vehicles travelling through the city, and that is our goal. However, we do know it will take time to get to that point. So the money that is raised has to be reinvested in transport related projects and policies. So we've got some examples on screen here. So controlled parking zones, which will be introduced around the border of the zone to protect residents, to stop people dumping their cars and walking in. There's funding there for the hydrogen bus pilot. There's city centre pedestrianisation and an enhanced programme of active and sustainable travel. The money cannot be used for services such as bin collections, and despite reports in the media, will not be used to improve the floozy and the jacuzzi. Next slide. Yep. Okay, so here's an example on screen of the vehicles that will not be charged. So if your vehicle meets the standards on screen, you will not be subject to charging. So for petrol vehicles, that is Euro 4 standard or better. So that's most vehicles from 2006 onwards. For diesel, it's Euro 6, most vehicles from September 15 onwards. And then we've also got gas Euro 6, fully electric, fully hydrogen fuel cell, and hybrid electric that meet the petrol and diesel standards as above. We do have a government vehicle checker now, so you can go online to the Brumbury's website. There is a link then to the government vehicle checker where you can input your registration number and it will tell you whether or not you're subject to the charge. You can also check in your V5 logbook and it will tell you what Euro standard you are. So we appreciate at the moment that you're all incredibly busy in the midst of a pandemic, and our job here is not to make your job harder by adding work to you. We want to take that workload from you. So on screen are some of the methods that we are already utilising to contact and inform people of the clean air zone. So we've got our website, we're delivering webinars such as this, we have newsletters, we're doing print mail outs to people who live in the zone, we are including advertising in council tax publications. We're working with the press, we have radio advertising, etc. So we're doing a lot to get that message out across the city and wider region, but we appreciate that you guys are very busy. You're likely to be impacted with your staff and your patients, potentially in some way. So what we want from you is to hear how we can provide that messaging for you, whether it is wording for text messages, it's wording for letters. If there's costs involved, let us know. The idea here isn't to be adding to your workload, it's to be ensuring that you and your patients and your staff are fully informed, and we want to help you do that in the most succinct, easy possible way. So on screen, like I say, is what we're doing at the moment, or some examples of, but please let us know if there's anything that you think would be really beneficial to your practice that would help with supporting your patients and your staff. I'm going to hand over to my colleague Pete now. He's going to talk through the exemptions and wider support that's available.
Thank you, Gemma. Yeah, good morning. My name is Peter Edwards, Principal Clean Air Zone Officer within the Clean Air Zone team, with overall responsibility for delivering the exemptions programme. So the exemptions are designed to give people, I describe to give people some breathing space and to work out if they are impacted, if they have a non-compliant car, what are they going to do? Are they going to upgrade that vehicle? Are they going to begin travelling in a different way? And these exemptions were determined via the consultation in 2018. That consultation was not a consultation to ask whether or not we should do a clean air zone. It was because the government had mandated it and it was required. The consultation was to identify which groups, which stakeholders would need the most support. That consultation received something like 11,000 responses, by far and away the biggest response Birmingham City Council has ever had to a consultation. And off the back of that, we've designed a package of measures of exemptions and financial support. So you can see on screen that people that live within the clean air zone with non-compliant vehicles can apply for a 2-year exemption. Probably most relevant to the people on the call today is the what we describe as the clean air zone workers exemption for people earning less than £30,000 a year and working more than 18 hours a week within the zone. It's important just to note at this point that these are all available to apply online at the moment. It's a simple method. You create an account, upload some proof documents, and my team will then process that. And if we need anything more, obviously come back to you. But it's all open for application at the moment. If your medical practices where you work have any vehicles that you utilise, and they're based within the zone, then they may also be eligible for a 1-year exemption. And then, of course, for those medical centres in the clean air zone that offer out of hours and emergency services, so that's Badger, Bathrow and the Children's Hospital, they will be able to access a 1-year exemption. And I think the next slide, Gemma, is giving more detail about that. Yes. So those exemptions that you saw on the previous screen for workers and residents, that's an online application process where you will have your vehicle, if you're successful in your application, you will have your vehicle registration added to what we're calling a whitelist. So that will mean that the cameras will pick up your car, check against a record on a computer and denote that you've been granted a temporary exemption. For patients, visitors to the medical centres on the screen here, there will be a different process which will involve a voucher scheme. So your patients, visitors will come to a reception desk or somewhere that to be determined, and we want to do this in collaboration with the medical centres on screen. They will be handed a voucher, and that voucher will be they will be able to credit that voucher online. That will be 1 voucher per visit, so same as Gemma described before in terms of you need to pay for each day, so you need a voucher for each day if you're a returner, perhaps at the Children's Hospital with visiting on multiple days. The 13-day payment window still applies, so you could credit a voucher in advance on the day or after, and this will launch on the 1st of June, subject to same as the zone, and the medical centre voucher system is in development at the moment. We're about to have the final version handed over to us. We tested it in 2020, and we will have the almost finalised version in February. So it will be ready to go ahead of the zone going live. Next slide, please, Gemma. So in addition to those exemptions that we've just talked about, we also have what you can see on screen. So these other vehicles that will have ongoing exemptions. So if blue badge holders do not have an automatic exemption, but if your vehicle has a disabled passenger tax, so you're in receipt of specific benefits, then you will have a national exemption. This is noted on your V5, on your logbook, from all clean air zone across the country. Motorcycles will not be charged, and then the specialist vehicles like emergency vehicles, showman's vehicles, recovery, these will have an exemption. Historic vehicles, so over 40 years old, and finally community and school transport, so this is your ring and ride sort of services, will also have an exemption. So if we can move on to the next slide. So in addition to the exemptions, we also have financial packages available to support people to transition towards the clean air zone. The most relevant to the people on the call today is the one at the top, so that's a scrappage scheme that's in development at the moment for people working in the clean air zone. So those people that are eligible, earning less than £30,000 a year, working more than 18 hours a week in the zone, will be able to, in the coming months when the system is ready, it will be ready soon, to apply online to scrap their vehicle, and in return for scrapping that non-compliant vehicle, they will be able to access funding of up to £2,000 to either use how they determine on either a new compliant vehicle or for a mobility credit, so on a Swift card to use on public transport. There are also pots of funding for SMEs in the West Midlands for coaches and HGVs, and also a pot of money for taxi drivers and private hire drivers. But I won't go into a great deal of detail of that given the nature of the audience here today, but there's plenty of information about those schemes on our website, and both are open for application at the moment. Next slide, please. So the Clean Air Zone is coming on the 1st of June and is part of a wider transport plan from Birmingham City Council. And the transport plan was launched before COVID and has since been updated with the emergency transport plan. And you may have already seen some of these measures that have gone into the city during COVID to enable people to socially distance better on busy high streets, temporary cycle lanes using wands or cones. So these have gone up hastily to give people different options during the pandemic, and we've just been awarded a further, I think it's £16 million from the Emergency Active Travel Fund from central government to make some of these schemes permanent or improve them. So there's four main visions for this plan. The first one being to reallocate road space away from private motor vehicles and to people walking, cycling and using public transport. So that's the measures I described before: bus priority, bus lanes, cycle lanes. Then there's a desire to transform the city centre, again, to make it better for people walking, cycling and using public transport. Pedestrianisation schemes, more accessibility for cycling, cycle parking, that sort of thing. To prioritise active travel in neighbourhoods, so not just focusing on the city centre, the CAS area. So, for example, this is low traffic neighbourhoods which have been introduced in Kings Heath, and measures put into Bourneville, Castlevale and Lascelles, which are, again, just reiterating the point, making it easier for people to walk and cycle these short journeys that we know people are currently driving, and which just is not sustainable. And the final one, which Gemma touched upon briefly at the start, is to try and manage demand through parking measures. So removing any free parking from the CAS area, from the city centre, putting in residence parking schemes to stop people, as Gemma's pointed out, parking on the perimeter and then travelling in, walking in, or doing or getting the bus, which obviously has an impact on local residents. So just to kind of give a bit of context to where the CAS fits into all of this. Next slide, please. And yeah, I think this slide just kind of sums it up really, that obviously there is a climate emergency. We're in the middle of a global pandemic, a respiratory pandemic. So we need to be doing everything we possibly can to mitigate the impacts of air pollution. So the Clean Air Zone is part of the Route to Zero, the target to be net zero by 2030. And funding that we've received from central government has obviously been used to implement signs and cameras and all the schemes that I've just described previously, but we're also doing other things. So you can see here on screen that there will be an extensive programme of installation of electric vehicle charging points across the city. Press release went out this week for hydrogen buses. Those will be on our roads next year in time for the Commonwealth Games. And we also know that for Hackney carriage drivers, it's really difficult to upgrade to an electric vehicle. There's only one on the market and it costs, I think, £60,000. So what the council is proposing to do is to purchase some up to 50 and kind of run like a lease scheme, so that Hackney drivers are not left behind here, because it's much easier to upgrade a private hire vehicle than it is to upgrade a Hackney carriage, but we know that they play an important role in transport in our city. I think that may be the final slide. Yes, so just to sum up, there is our website. There is a wealth of information on that website. You can sign up for updates from us. We send a monthly newsletter. You can check if your vehicle is compliant. You can apply for an exemption. You can express your interest for the scrappage scheme. And there's a lot of information on the site. If you can't find the answer that you want, then please email us. So that's cleanair@birmingham.gov.uk, that's on the screen. And also we will follow up this webinar, anyone who's registered. So even if colleagues registered but didn't manage to attend, we will send an email. This webinar is being recorded. We will send the slides and a wealth of follow-up information. So that concludes the presentations. I don't know if there's any questions in the chat box. It doesn't look like it. So me and Gemma will just go on mute for a second and just see if there's any questions that pop up. But if not, we will end the call, but we'll give it a few minutes. Please do ask any questions while we're here. And as I say, we will be in touch following the webinar with more information.
Just to reiterate, as we mentioned at the start of the call, if you do have, we appreciate you need to contact and communicate this message with your patients, etc. We do have resources online that you can download to display around your practice. So we've got posters, we've got templating messages, so you can communicate with staff, that you can use to write to your staff, etc. So, you know, do check out the website. Like Pete says, we will send a link with some of the resources that's available. But if you are, we appreciate you're busy at the moment with the pandemic. So please do come to us if there's a method of engagement that we're not currently doing that would absolutely benefit your patients, your staff, etc.
And we've had one question come through, Gemma, asking, will there be an app to make payments? Not that I'm aware of, but the .gov, it will be via the .gov website, which will have full functionality on mobile. But as far as I'm aware, and I think Gemma's probably more clued in than me, there's not a specific app being created for Clean Air Zone payments, as far as I'm aware.
There's been no reference to that at the moment, no. So the payment portal is being managed by the government. Because they will be, there's several clean air zones being launched as mentioned, so they'll be in Bath, Bristol, etc. So there's been no reference to that at the moment. Whether or not the government changed their stance on that, as soon as we know, we will let others know.
Thanks, Gemma. We'll give it another minute or two, and then we'll end the call if there's no further questions. But thank you very much for attending this morning. I hope you found it useful. If you need more sessions like this, we can deliver them for you and for your staff. And if there's a way to do this to get to your patients and other stakeholders, contractors, whatever, then we're open to delivering that. Actually, it's easier to deliver this sort of thing in a COVID world. It's not so engaging as doing it face to face, but we can perhaps reach more people easily doing it this way. But I'll go on mute, and then if there's no further questions, we will end the call in just over a minute. Thank you.
Okay, in that case, I guess we'd just like to thank you all for coming today. Appreciate your time. Please do keep in touch with us, and we wish you all the best. And yeah, like we say, keep in touch and let us know if we can be of further support. Take care. Bye bye.